Welcome to Tuesday's edition of COVID-19. I'm Sun-jae. Korea's quarantine measures have been divided into 3 levels depending on the severity of the situation. We are currently at level 1, where daily life measures are considered adequate at keeping the virus at bay, but health authorities are on high alert as cases continue to climb. We start the program now with our Kwon So-ah and Hyunkyung Tan here in the studio. Right, let's begin with the latest updates on the pandemic here in Korea and abroad. Our So-ah will start us off with the domestic figures. So-ah.
Sunny, the situation hasn't changed that much compared to yesterday, but we have a surge in imported cases today, different from Monday. Now, if we take a closer look at the figures, we have 43 new cases today, bringing the total to 12,800. And 23 of these cases were local transmissions and the other 20 imported cases, which means almost half of today's caseload were imported cases. And we have 282 fatalities. The number remains unchanged since Friday, so for the 5th consecutive day, while we have 981 people still in quarantine, which means the number has dropped to 1,000, which is good news. Meanwhile, the number of recovered people stands at 11,537, as 108 people have made a full recovery in the span of a day. And if we take a look at how the situation developed over the week, now, as I said, we went from 42 to 43, and last Tuesday we had 46 cases, so the 40s seem to be pretty much the average, but we did have some ups and downs, even surpassing 60. Now, although there hasn't been a drastic change in the figures, the concern is that these cases are now more scattered across the nation, not only concentrated in the metropolitan region, but of course, we again have many cases in the greater Seoul area, with 7 in Seoul, 7 in nearby Gyeonggi-do province, and 3 in Incheon. But as I said, also here in the center in Daejeon, 5 new cases, in Gwangju, 3 new cases. And now let's get a check of the global updates. With a daily rise of more than, or I should say almost 161,000 new infections, the total stands at 10.4 million as of 12 p.m. Korea time. Less than 5.7 million people have fully recovered, while the death toll stands at over 508,000. And let's take a look at countries with major outbreaks here. The U.S. with almost 2.7 million cases, as 45,000 were added in the span of a day, and also followed by Brazil, 1.37 million, as this country has over 25,000 new cases. And India, another concern here, with 567,000, with up 18,000 cases up. And moving over to Peru, we have 3,000 new cases here, bringing the total to 282,000, followed by Chile and Italy, and Mexico here with 220,000 cases, as 3,800 cases, that is, have been added in the span of a day. And those are the COVID-19 updates, but I'll be back here after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you later at the desk. Now, data shows that the global economy posted negative growth in the first quarter of this year due to COVID-19. For more on this unfortunate but largely expected reality, I have Hyunkyung Tan in the studio. Hello, Jung Min.
Hello, Sunny.
Now, economies across the world shrank. Let's begin with Korea, Jung Min.
Well, like you said, Sunny, major economies like the U.S. and China have already seen a sharp decline in growth this year. That's the first quarter of this year. And the South Korean economy has also seen negative growth during the same period. Well, but things are looking relatively better for the local economy. In its latest projection, the IMF predicted Korea's GDP to shrink 2.1% this year. That's a discouraging figure, but it's relatively better when compared to other global economies. For next year, the agency expected the country's economy to rebound and grow by 3%. The agency credited South Korea with handling the health crisis at an early stage to a moderate degree of success. It also attributed its forecast to the South Korean government's aggressive expansionary policies. But the South Korean economy already contracted by 1.3% from January to March this year. I've talked to an expert on this, so let's take a look.
This year's economic growth will be determined by the length of the pandemic. If it lingers for longer, that would pose a greater threat to our economy. Even optimists expect a growth rate similar to that of the 2008 financial crisis, while pessimists are expecting figures seen during the Asian financial crisis.
In fact, the IMF said the world economy will contract by 4.9% this year. It's down nearly 2 percentage points from its earlier prediction 2 months ago. The IMF said it's mainly because of the coronavirus impact, describing it as a crisis like no other.
Indeed, Changmin. Now let's turn to the U.S. I understand alarming surges in the number of COVID-19 cases there have been severely hampering economic activities.
Yes, you're right, Sunny. The U.S. economy in the first quarter saw its largest contraction in more than a decade, probably. The Commerce Department said last week that the U.S. economy shrank by 5% from January to March. It was the sharpest quarterly decline since the fourth quarter of 2008. That was when the economy shrank more than 8% amid the global financial crisis. The department said the decline was largely due to nationwide stay-at-home orders issued in March. And worse is just yet to come. Economists predict the GDP will plunge around a staggering 30% from April to June. But forecasters believe the economy will rebound in the second half of the year. The IMF predicted the U.S. economy to decline by 8% this year. Now looking at job numbers, the Bureau of Labor Statistics said nearly half of the population in the U.S. was out of a job in May. It said the employment population ratio plunged to around 53% last month. That means some 47% of Americans are jobless. This is because economic concerns linger in the U.S. due to shutdowns. Now, the COVID-19 situation in the southern and western regions of the U.S. are worsening, including Texas and California. The state of California has declared a partial rollback on its efforts to reopen the economy, ordering some bars to close due to a spike in the number of infections. Take a listen.
The bottom line is we're doing this because we have seen an increase in the spread of this virus. We've been very clear, and this shouldn't surprise anybody watching. As you reopen the economy, as we move away and make the meaningful modifications which we did to our stay-at-home order.
So it all depends on how the health crisis plays out. If a second wave of infections materializes next month, experts say it will cause seismic losses for the entire year.
Right, well, let's hope the situation will get better there. And elsewhere, now over to China. How does the economic situation there look like?
Well, right, the Chinese economy also contracted in the first quarter, for the first time in decades. So the China Statistics Bureau announced that the country's GDP was down 6.8% on year from January to March. This was the first time China has officially posted negative growth for any period since 1976. The Chinese government imposed large-scale shutdowns in January and started to gradually resume economic activities in March. In its latest report, however, the IMF predicted China's economy to grow 1% this year. Now, as for Europe, the IMF projected the EU's economy to tumble 10% this year. That's a staggering number. Germany, France, Italy, and Spain are all expected to be hit hard due to the pandemic impact.
All right, that was a wrap-up of the global economy by our Changmin. Changmin, thank you for talking to me today.
Thanks for having me.
Right, it's time now to join the regular afternoon briefing on COVID-19 here in Korea. Authorities are reportedly looking into the possibility of designating churches as high-risk facilities. The move comes in response to the soaring number of cases linked to places of worship in recent days. Under current guidelines, indoor gyms, bars, clubs and singing rooms are on the list of high-risk facilities. According to Korea's Centers for Disease Control and Prevention, at least 500 people have tested positive in relation to the outbreaks at churches across the country as of this week. Yet another concern is the reality that the fresh spread here in the metropolitan region has led to cases in remote parts of the country that have previously been considered safe, including South Jeolla province, where authorities confirmed the first case in almost 3 months. Now, the Greater Seoul area now accounts for more than 22% of more than 12,000 cases that have been reported nationwide. We have the briefing that is about to start now, so we'll come back to you after it with our Kwon So-ah for a summary of the key updates.
네, 6월 30일 Let us now begin our regular briefing for June 30th, Tuesday, on the COVID-19 response here in South Korea. As of today, we have 23 new local infections, and we have new additional imported cases, and now the total number of confirmed cases stands at 12,800. A total of 108 more people have been discharged following full recovery, and the people in quarantine now stand at 981. And there were no additional fatality, and the fatality rate now stands at 2.22%. And here are some of the updates on our domestic infections. At the Hwangseong Church in Gwangju District, Seoul City, we have 3 additional cases. In total, we have a total of 31 cases being confirmed to date. Of them, 26 are the members of the church. And also related to Lord Glory Church in Anyang City, Gyeonggi-do Province, we have 1 additional case. The total now stands at 23, and 19 of them are the congregations. And also at a religious small meeting at the Suwon, city of Gyeonggi-do Province, we have 1 additional case, and the total now stands at 8. And in Gwangju City, regarding the Gwangneuk Temple, we have 2 additional cases being confirmed, and now the total stands at 14. And in Daejeon, on the 27th in June, we also did an investigation survey, and we have identified that there were some sporadic cases and continuous transmissions, and a total of 9 people have been confirmed. And we are tracing the contacts as well as conducting the epidemiological investigation. During the past week or so, we have identified that there were increase of the confirmed cases among the age of 20 and 30, and therefore compared to the previous week, the ratio of the higher age group has decreased by 6.2 percentage points and now stands at about 27%, and therefore the fatality rate is also continuing to decrease. And yesterday we had 20 new imported cases, and the countries are as follows: 3 are from America, 1 from Europe, 2 from Africa, and 14 from Asia, excluding China. And these countries include 10 people were also from Kazakhstan. And yesterday, we did caution the public to have a special particular notes on the religious facilities. And we also did an extensive survey on the areas of exposure to infections for these religious facilities. And as for the Lord Glory Church in Anyang City, Gyeonggi-do Province, we identified that there were about 11 sources of infection. And also right now we have about 3 new confirmed cases, which is relatively small. However, we could confirm that there are 11 sources of infection. And also at the Hwangseong Church in Gwangju District, we have identified, aside from the church, 8 additional routes of infection. And they included the logistics centers, business establishments, offices, and private academies and daycare centers. And so we have found that they are spreading fast in diverse routes, and these pose high risk of local transmissions. Therefore, we ask the public to take precautions to prevent further infections from the small religious group meetings. Once again, we highlight the public to be on special alert, as these small religious group meetings are prone to high infections among the transmission of respiratory droplets. So we ask you to switch to non-face-to-face alternatives. And if you have to have a physical meeting, so please reduce the number of participants to ensure a certain distance among them. And please do not go to these meetings if you have symptoms like fever or other respiratory symptoms. And you should also always wear face masks and wash your hands on a regular basis. And religious facilities also need to refrain from providing meals or engaging in activities that release respiratory droplets in the air, such as singing, chanting, and shouting. And in relation to the infections with the religious centers, if they continue, we are also mulling a possible legal action on these small meetings that are carried out at the religious centers. So we ask the religious circles to take voluntary actions, and we make these announcements once again. And next is the antibiotic, the testings and the analysis that we have carried so far here in South Korea. And the KCDC is also carrying out an public nutrient survey for 2020, and we have identified about 1,500 antibodies of cases, and they have been conducted and accumulated from time for a large period of time, and they have been also they also include about 1,500 of the antibodies that have been collected at the southeastern part of this country during the early May, and we have conducted our testings on these antibodies, and we are conducting our analysis. And in the future also, we will conduct our public analysis on the public nutrients, and for every 2 months. And during July and August, this will also be carried out in the Daegu and Gyeongbuk region, so that we will carry out a testing on the antibodies that are in the wider public. And these are also of the first round of analysis, and once we have a full conclusion of such analysis, we will review we will have these data reviewed by the experts, and we will disclose them to the public for their information. The KCDC also is carrying out its research on therapeutics for the plasma therapeutics, and we have identified that 80 more people have agreed to donate their samples, and a total of 229 people have showed their intentions to donate their plasma samples. And of them, 88 people have actually donated their samples, and we thank them once again. And last but not least, we are in the monsoon season. The monsoon season is also very high. It have high risks of infection diseases like skin diseases and those diseases that could be carried by mosquitoes and other insects. So we ask the public to also take particular cautions to prevent any infectious diseases. And as for the EHEC, we also have diverse other forms of the virus which can spread through the food and other food poisonings infections as well. And also we have a high risk of infections through that can be carried through mosquitoes, and especially in the northern part of the Gyeonggi-do province, we also advise the public to take precautions on the possible spread of malaria. And last but not least, related to COVID-19, we have some other words of announcement. Today, the WHO also highlighted, but in the past 6 months, the global number of confirmed cases is now over 10 million, and the fatality is over 500,000. This is just an official number. However, the number is continuing to rise. And according to WHO, nationwide, about 190,000 more people have been infected nationwide, and the number is recording ever high on a daily basis. And in the influenza also leads to an estimated death of about 56,000 on an yearly basis. However, we have confirmed that the COVID-19 has exceeded this number just in 6 months. And also it is also more concerned as the COVID-19 is not yet ended, and therefore this is also a great and a grave threat to the public health. Moreover, and if you look at the research done internationally, we also have concerns of a possible herd immunity on the public after going through COVID-19. However, these are just some parts of hopes. And as we conduct our surveys and analysis here in South Korea, we will do the research and disclose the conclusion. However, we don't believe that these numbers will be very different from those of other countries. And COVID-19 and as well as other novel infectious diseases, no country has an effective solution to combat the virus. And the KCDC also is preparing for a prolonged battle against the COVID-19. And we will exert our full efforts to curb the further spread of the virus and delay the spread of the virus so that we can minimize the damages. And based on the scientific evidences, working together with the medical experts, we will devise an effective scheme of a response. And we should note that there is no place around us that is safe. If one of us is infected, this could lead to local infections, and anyone can become victimized to the virus, and we can also be victimized to and become the targets of self-isolation. So at all times, we need to also keep distancing and keep quarantine measures as well as personal hygiene measures. However, it is hopeful that on a daily basis, we are increasing our knowledge on the COVID-19. So we have accrued more knowledge, and it will continue going forward. And the entire global community is working together to develop a therapeutic and vaccine. So we believe these are hopefuls, and thank you very much.
Right, that was Tuesday's afternoon briefing by the government on the COVID-19 situation here in Korea. And Soa is back here to give us a summary of the key announcements.
Right, well, it looks like religious facilities were another keyword today, just like yesterday, and that is because the government is mulling over whether to designate religious facilities as high-risk facilities, and that because we are having continuous infections at religious gatherings, including in the capital Seoul and nearby Anyang and Daejeon, and even in Gwangju, where we have some cases related to a Buddhist temple. And according to Kwon, in the past week, there were more and more infections of younger people between the 20s and 30s, while people aged 60 and over, infections in that age group dropped by 6.2 percentage points to around 27%. So that may be good news because that also brought the fatality rate down. Now, meanwhile, he also mentioned how the World Health Organization's earlier prediction of total cases around the world the annual prediction has been actually surpassed in just 6 months. And that is a concern, especially as we're also having more imported cases. Today, for instance, we had 20 imported cases from the Americas, Africa, Asia, and especially a lot of cases from Kazakhstan, as we have 10 new cases there. So it looks like domestic infections and imported cases remain a big concern.
All right, Soa, thank you for that. We'll see you again on Wednesday.
See you tomorrow.
Elsewhere around the world, authorities in the U.S. are scrambling to slow the spread of COVID-19 as 3 of its most populous states have been setting new records for daily highs. These states include California, Florida, and Texas. For a better understanding, that is, of the situation unfolding in California, I have Cynthia Che live on the line. Hello, Cynthia.
Hi, Sunny.
Cynthia, please tell us a bit about the situation with regard to COVID-19 in California, where you are.
Yes, so unfortunately, California has the unfortunate distinction of being in the top 10 states that has rising spread of the coronavirus. And as such, our governor has pulled back reopening and ordered bars in certain counties to close due to the spread.
Cynthia, some are claiming that the reason behind the spike in cases is the overall dense population, including that of young people. How is the public responding to these surging cases, and what measures are being taken further to tackle the latest spread of the virus?
Well, unfortunately, we have elected officials sending out mixed messages about what they should do. we know right now, without the vaccine, without treatments, that the best defense is social distancing and wearing a face mask. And unfortunately, that's been politicized in the United States. And so you have residents of California going out, and again, it's become a political statement rather than a public health measure. And so you have elected officials exploiting this situation and, again, sending out mixed messages, including young people. And that's unfortunate because we know the spread is happening amongst family members who are out and being exposed to the virus.
Cynthia, I understand you're involved in anti-racism activities as well. Now, there are health experts who believe the recent nationwide protests in light of the death of George Floyd, an African-American, while under police custody, have severely hampered quarantine efforts. What are your thoughts?
Well, I have seen those reports that there were allegations that the protests itself have led to the spread. And we have seen data and reports that say otherwise, that because the protests were outdoors, the fact that protesters were wearing masks and encouraging social distancing where possible, that really the spread is happening in indoor settings and by families coming together and breaking quarantine and social distancing.
Now, even before these protests in memory of Mr. Floyd, there have been a number of racist incidents worldwide that triggered online campaigns denouncing such discrimination, especially against Asians from the Far East, including China, where COVID-19 was first confirmed. What efforts are needed, Cynthia, to address these unfortunate events?
Yes, so our organization has been tracking incidents of hate since mid-March. And to date, we have over 2,100 incidents coming from across the country, over 800 in California alone. And we are asking our government officials to respond to these forms of discrimination and civil rights violations. And community organizations are coming together to speak out, and in particular, hold the President of the United States and other high-level elected officials from referring to the virus as the Wuhan virus or the Kung flu virus, a very racist statement that is fueling anti-Asian hate and also leading to other types of efforts to restrict immigration and to blame people of Asian descent. So these are things that we are trying to forcefully counter, including condemning this rhetoric, as well as policies that are attempting to scapegoat our community.
All right, Cynthia, thank you for that and for making the time to share your thoughts, that is, with us live at this hour.
Thank you so much, Sunny.
Now, we have yet to find a cure for COVID-19, but studies show blood plasma is providing a possible therapy for quite a number of patients. We have more in this report.
중앙방역대책본부는 코로나19 확진자를 위한 혈장 치료제 개발에 완치자 여러분들의 적극적인 참여를 요청드립니다.
In April, Korea's first ever blood plasma treatments were administered to a pair of critically ill COVID-19 patients. Utilizing the blood plasma extracted from those who had recovered from the illness, both patients were fully cured around 20 days after receiving the treatment. Human blood can be divided into two main components, namely blood plasma and blood cells, with antibodies being contained within blood plasma.
항체 중에서 중화 항체라는 게 이제 치료 효과 내지는 예방 효과를 나타내는 건데 중화 항체는 그 바이러스에 달라붙어서 바이러스가 없어지게끔 돕는 역할을 하는 면역 기능을 갖고 있는 겁니다. 중화 항체가 없는 급성기 환자한테 이미 회복한 사람들의 혈장 속에 있는 중화 항체를 넣어줌으로써 이 급성기 환자가 면역을 갖게 해서 수동 면역이라고 저희가 얘기하는데 그 사람이 회복할 수 있게 돕는 그런 치료법입니다.
In short, blood plasma extracted from recovered COVID-19 patients can help cure those who are infected.
혈장 치료제는 완치자의 혈액 속에 포함된 항체, 면역글로불린을 농축하고 제재화하여 사용하는 것이기 때문에 많은 혈액의 확보가 필요합니다.
Therefore, large volumes of blood are needed from recovered patients in order to make this treatment viable. Many high-profile celebrities who contracted COVID-19 are stepping forward to donate their blood plasma to aid the development of blood plasma treatments around the world. Blood plasma donations are also taking place here in Korea. In one local church where a mass infection had occurred, 21 recovered patients donated their blood plasma together as one group.
의료진 분들에 대한 이제 감사한 마음 때문이거든요. 어떻게 보면 자기도 위험 부담이 있는데도 적극적으로 이 치료를 해주시는 그런 모습들이 진짜 너무 감사했고, 제가 이제 그 입원하면서 되게 이 코로나라는 병이 얼마나 막막한지 알기 때문에.
For those who had once contracted COVID-19, donating blood plasma can be a jarring experience that reminds them of the illness they had. Despite this, blood plasma donations are steadily rising nonetheless, in the hopes that they can save other lives.
총 208명이 등록을 해주신 부분에 대해서 적극적인 참여에 깊이 감사를 드립니다.
Blood plasma treatment is not a be-all, end-all remedy for COVID-19, but remains an effective temporary solution until a vaccine or a cure is found eventually.
혈장을 이용해서 면역 글로불린을 만들어서 이제 투여하는 약을 개발하고는 있는데, 그게 시판될 때까지는 또 한 최소 6, 7개월 이상 시간이 걸리거든요. 근데 그때까지 또 중환자는 계속 생길 거기 때문에 이런 수혈의학 방법을 통한 혈장 치료법이 그 전에 같이 시도가 돼야 되지 않을까 싶습니다.
The COVID-19 pandemic.
COVID-19 cases.
For a second wave of COVID-19,
COVID-19
virus continues to spread in metropolitan.
It's been about 6 months since the first case of COVID-19 was confirmed in China, and today there are more than 10 million cases across the globe. Fears of a second wave are growing, as are the cases worldwide. And in today's studio session, we gauge the current situation and more. I have Dr. Tan Hyunkyung from MizMedi Women's Hospital. Good to see you again, Dr. Tan.
Thank you for having me.
And I also have Professor Sun-jae from Yonsei University. Good to see you again, Professor Jung.
Thank you for having me.
Professor Tan, let's start off with a broad question. How do you assess the current global COVID-19 situation?
Well, there are certain countries, Vietnam, New Zealand, and Taiwan. These countries continue to show the world that COVID-19 can be managed successfully. They can have open societies and schools are open. Economic activity is on the rise. And so these are really countries that are showing us a great example of what can happen with COVID-19 in a positive light. However, there are countries that are struggling in terms of trying to get COVID-19 under control. These are Russia, Brazil, and the Indian subcontinent. The good news out of North America and Europe is that the number of daily deaths has decreased. And so that is something that we can take as good news. However, as was mentioned, the number of daily cases, there has been an uptick in many regions, perhaps because the restrictions have been eased. Now, Europe is poised to open their borders for tourism. And so that, I think, is making a lot of people nervous because here in Korea, we've had more than 1,500 imported cases. About half of them were detected in quarantine. I'm not sure if there are other countries that are as committed or capable of containing those imported cases as we have done here in Korea. And so it's a looming question as to what will happen once borders open.
Right. And staying with the situation here in Korea then, Professor Jung, health authorities here have announced that we are witnessing possibly a second wave in formation. Now, how do you assess Korea's COVID-19 situation? And do you think it's within manageable capacity?
Okay, the recent trend continues with about daily new cases from 30 to 50. And I think this is really breathtaking because the current capacity of the medical resources would matter in this massive outbreak. As announced on last Sunday, the number of patients with group infection increased as 14 cases, and the percentage of confirmed patients with unknown infection route infection was increased from 8.9 to 10%, and the rate of the manageable patient in the quarantine network was less than 80%. So in particular, the key to corona control is the acceptability of the medical system that can accommodate the patient in case of mass occurrence. So in particular, it is predicted that at this time, the proportion of critical ill patient is also important. And because, for instance, even if only like 0.5% of the COVID-19 diagnosed patients are severe cases, it is predicted to be impossible to handle the patient nationwide at current level. So again, it's very breathtaking moments.
Right, it is. And before we continue to delve into the situation here in Korea, over in Europe, efforts to establish a sense of normality by lifting lockdowns and easing quarantine measures have led to surges in cases, prompting quite a number of countries there to reimpose certain restrictions. For more on the situation in Europe, I have David Cox, a journalist at The Guardian, live on the line in London. Hello, David.
Hi, Sunny. Thanks for having me.
Thank you for being with us, David. Now, what is the overall situation in Europe like?
So at the moment, there have been big rises in the number of cases in Germany, Italy, and also Switzerland in the past week. And we've also seen smaller outbreaks in the UK, France, and Spain. In Germany, the crisis is particularly worrying because the reproduction rate of the virus has jumped to almost 3 in the past week, after this outbreak at a food factory. And food factories do seem to be a center for new outbreaks at the moment in Europe.
I see. David, how are countries in Europe then, including the UK that is, preparing for a possible second wave?
So at the moment, countries are trying to sort of prepare for the second wave and also limit the economic crisis by doing local lockdowns. So, for example, in the UK, we have had a rise in the cases in the city of Leicester. And so yesterday, the government reintroduced strict lockdown measures just for that city, closing schools and all non-essential shops. And Germany have also put 2 regions back into lockdown and closed schools until the end of the summer holidays. And also quite a few countries are trying to copy the Korean example and get contact tracing apps up and running.
And speaking of the Korean example, David, the World Health Organization has praised Korea's strategy against COVID-19. What do you suppose has made it possible for Korea to effectively tackle and, of course, continue tackling the pandemic here?
Well, I've been covering the situation in South Korea a lot, and I think there's a couple of key reasons. The first big one is the scale of the contact tracing regime. So Korea used so much more data than contact tracing in Europe, which means people are alerted faster, and that helps control these new outbreaks. But also the Korean population has also respected the message to stay home as much as possible, far more probably than here in the UK, I think. And as you say, the Korean quarantine measures are very, very unique.
All right, David, thank you for that and for making the time to join us live with your thoughts.
Thank you.
Professor Dan, the whole idea of our tracing scope is something you'd always mentioned before as well when you're on the show. Professor Chung, health authorities have disclosed a 3-level response system to COVID-19, detailing the respective quarantine guidelines to go along with those 3-level response system. The levels depend on the number of daily cases, and given that they are, of course, taking place over a period of 2 weeks straight, every day that is. Yes. Level 1 refers to cases below 50. Level 2 refers to cases below 100, and level 3 refers to cases below 200. Is that it? How effective will this alert system be?
Yes, this new guideline was made and reorganized to clarify the prevention intervention and increase the predictability and reliability of the social distancing. The guideline was made with reference indicators such as daily number of confirmed cases, untraceable infection, manageable group outbreak, and infection in the controlled quarantine network. The capacity of the medical system will be critical to judge the stage between 1 and 2. And also the severity of transmission will be important between judging stage 2 and 3. In current status, I think it is too early to judge whether this government action would be successful or effective or not. However, there are some hurdles we should consider. Overall, there would be pressure from domestic economy, and also the issue of declined alertness of general public would matter too. But to prevent explosive transmission and turmoil of medical system, it is agreeable and understandable of this government pursued more strict measures for the future long-term plan.
Right. Professor Jung, thank you for that. Dr. Tan, health authorities have claimed that a person can take off his or her mask when they're outdoors and when they are 2 meters away from others. But I read that respiratory droplets can travel 10 meters. Is this advice safe?
Well, you know, the way that respiratory droplets are formed, basically they're viral particles coated in respiratory secretions. They tend to be a little bit heavier. And so after they're expelled from the body, they do tend to drop to the floor or the ground within 1 meter. If there is a certain draft or recirculated air, it could be a different scenario. But if you're outdoors, the ventilation will disperse the particles, making it much more safe. And so if you are in an uncrowded area outdoors, I think it will be safe to take the mask off. But of course, if you see crowds around you, or if you're going to enter into a crowded area, that's when even outdoors, you should put the mask back on.
Of course. Professor Jung, there are numerous reports of asymptomatic patients. Please tell us a bit more about the danger that they pose.
Oh, yes. The exact number of people with asymptomatic infection is, in fact, actually difficult to know about the actual number. However, when talking about the asymptomatic people, I think 2 things are important. Number 1 is the percentage of infection that are asymptomatic. And number 2 is the infectivity of the asymptomatic cases relative to symptomatic cases. And the number of asymptomatic patients was estimated to be 30% of the total patient. And there is a report from China that the infectivity of these asymptomatic patients would be like 1/3 of that of the general diagnosis. But the important thing is that even asymptomatic patient can spread the virus.
Right, and that is scary to know, of course. Dr. Tan, there has also been much debate over the use of anti-inflammatory analgesic drug on COVID-19. What does the public need to know about the use of this particular drug?
Well, so inflammation does seem to be a central mechanism for what's going on with COVID-19. And so there's a lot of research into this. But in terms of NSAIDs, so non-steroidal anti-inflammatory drugs, I don't think they can be considered a treatment for COVID-19. And actually, the US CDC says it's better to use Tylenol or acetaminophen to treat fever in COVID-19 first. We're waiting to see what's going to happen in terms of the results with steroids. These are also anti-inflammatory drugs, and there's a big trial and the results are pending. But hopefully we'll see some good news out of the UK in terms of using a medicine called dexamethasone to treat COVID-19.
So we'll keep our fingers crossed for that then. Professor Jung, it is said that COVID-19 can prove to be fatal for those with pre-existing health conditions. What disorders are particularly dangerous?
Well, actually, the most popular risk condition is older age. And also having certain underlying disease conditions such as chronic kidney disease, COPD, immune-compromised state, or obesity, or serious heart conditions such as acute coronary heart disease or heart failure would matter too. And some hematologic diseases such as sickle cell diseases and type 2 diabetes also reported. And also the hypertension, asthma, cerebrovascular diseases, and also smoking is known as the risk factor for severe illness from COVID-19.
Dr. Dan, do tell us a bit more about the use or the proper use of hand sanitizers. Because there was a case of a little boy, I think a 5-year-old, who suffered severe eye damage when he had that sanitizer spurted into his eye or something.
Right. So the highest risk for hand sanitizer is in the pediatric population because accidents like that can happen. Sometimes they think it's something that they can drink, or if they suck on their fingers after they have it on their hands, it can actually lead to alcohol poisoning. However, for most adults, it's completely safe. So as long as you put a good amount on your hands, wipe it on your palms, on the back of your hands, and allow it to dry, then you should be safe. I should say, however, that using soap and running water is better than alcohol-based hand sanitizer.
That is good to know. That is good to know. Professor Jung, one final question before we let you go. What are some of the ways of preventing cluster infections which have become a major concern here in the metropolitan region?
Actually, we are going through a very critical period, I think. Although the number of confirmed patients is beginning to be lower than the earlier period of the epidemic. However, the current situation seems to require stronger quarantine management and physical distancing. And I think the sporadic group infection in the metropolitan area, the people who reside there should be very alert to the request of the quarantine authorities in their daily lives, such as avoid going out or meeting, or avoid visiting multi-use facilities, or keeping distance between people, and don't forget to wear face masks and using hand sanitizers or hand washing. And please consider the effort of the medical staffs right now, because they are wearing this hot protective clothing in the weather like this. Well, thank you.
All right, Professor Jung, thank you as always for your thoughts. And Dr. Tan, as always, thank you for your information today as well.
Thank you.
Right, now on that note, we end today's coverage of COVID-19. Do tune in tomorrow at this hour as we explore joint efforts to combat COVID-19. In the meantime, do share your thoughts and inquiries with us through our social media accounts or homepage, arirang.com. Do take care and see you tomorrow.